I think what really drew me to diabetes care is the fact that as I was training in medical school, there were new medications coming out, so there was some hope at the end of the tunnel. There wasn't just, one pill or one insulin. There's so much that can be done with prevention. There's so much that can be done with lifestyle changes. It's just great to be in a field where really there's new medications every year, and it's an exciting place to be. Diabetes is a major issue in Ventura County. We find also that we have a lot of obesity, not only in our adults, but also our children. So some of our communities have a very high rate of obesity. About 7% of our patients have diabetes, but a whopping 47% of those patients have prediabetes. That would mean that if you add all the patients with prediabetes and diabetes together, over half the population has some form of either prediabetes or diabetes along that spectrum. Our clinic is just busting at the seams. We've been there for now over 5 years, and it started off small. I have several physician partners who have come on and joined me at the clinic, and we have a great staff. It includes dietitians, we have psychologists, we have nurse educators, and what I think really we offer is that it's one place where the patient can come and get everything that they need. Diabetes is complex. It's not just a prescription for a pill, it's not just a little advice and see you later. It really requires that you get to know the patient, you understand what their barriers are, you understand what changes might be made, what medication changes are appropriate, and so it's multiple different levels, and we have all that in one roof. So I think because we offer that service, the reputation is out there. We offer group medical visits where patients can come together and get education together with their peers and get advice from other people who might have diabetes as well, and those are well attended, and our outcomes in terms of glycemic control, blood pressure control, cholesterol, etc. are all very favorable. We just don't fit in the space anymore. We're basically running our classes in a hallway, and because the classes are larger, that hallway just isn't enough anymore. We'd like to have a bigger space. In my vision for a diabetes center, it would be great to really offer education for parents and their children, for patients with diabetes. So cooking classes, a kitchen area, an exercise area. So many places that, like a city where there aren't a lot of safe streets to walk on, it'd be nice to offer a little walking community, a community garden where people can kind of invest themselves in the food that they eat and really pushing for high quality food, not convenience foods and processed foods and a lot of the fast food options that are ubiquitous and contribute to the disease. We have patients who come to the class who lose 10 or 20 pounds just in the 6 months that they take the class and keep the weight off, which is great. And while that's not everybody that attends the class or comes to our clinic, those success stories really resonate, and it's really why we're there and provide that service. So I do think, and I'd like to think, that by opening a larger, more expansive and comprehensive clinic, we would be able to provide that levels of service not only to the community that we currently serve, but to the county, the wider county as a whole.
Personally suffering with diabetes, it was kind of important to know that a lot of people don't have the necessary needs to get it treated. Diabetes, being the #1 cause of adult blindness, is very dear to our hearts and minds. The ability to anybody to get treated is incredible, and the thought of having a caliber of clinic of this is just amazing.
I'm hoping to reach out to community partners to get support for the clinic. The County of Ventura has been a proponent for really offering high-level care for patients with diabetes. So within our own agency, I have had much support for growing the clinic. So I think in a partnership with both within the county agency as well as our community partners, I think that's where we'll get the most support. It's the right thing for the patients in the community who have diabetes or are affected by it.
I think it's going to be an overwhelming experience to see this diabetes clinic in full operation, treating thousands of patients a year from young to old. I just look forward to the day that it's all completed and done and operational.
We know that there's a growing problem with diabetes, but together we can really get control of it. Everyone together, working together to really hopefully get the best outcome.